So welcome back to our second session for today, Digital Health Serving Societies. Today we have Dr. Ghada El-Hajj Fuleihan, who has been with us as part of WiDS, making this healthcare section happen for the past 6 years almost. Dr. El-Hajj Fuleihan is a professor of medicine. She's the founding director of Calcium, Metabolism, and Osteoporosis program, WHO for metabolic bone disorder. She's the founding director of the SHARP program, Scholars in Health Research program at the AUB. And she is also a Bernard Lown Scholar at the Department of Global Health and Population at the Harvard Chan School of Public Health, Boston. Ghada, the floor is yours. We still cannot hear you. I think you're muted.
How is that? Is that better?
Perfect. We can hear you very well now.
Okay, thank you so much, Lina. I want to thank you, thank Lama, thank Mariette for this wonderful introduction. Really, it's been a great pleasure to be part of this transformative movement of women in data science over the last few years. Really exciting and very inspiring. What I thought I'll do is give you a quick background of how this relates to how we physicians and healthcare provider and public health officials look at it. There is no doubt that the digitalization of the healthcare system has resulted in a deluge of big clinical data and has prompted the rapid growth of data science in medicine. This is unstoppable, it's happening, we can't ignore it. This database is augmented by the wealth of massive information afforded through digital apps, not all health apps, that are permeating our life in a second-to-second, minute-to-minute, hour-to-hour basis. This has resulted in an explosion of publications underscoring the power of data science in augmenting health, personalized precision medicine, and public health delivery. I actually was curious to see where the field was going over the last 40 years, and I just did a PubMed search just yesterday. Just plugging in data science and healthcare got 78,000 hits. Not much is happening till the early 2000s. In 2020, there were 13,000 publications. 2021, 14,000 publications. We all realized that to be able to synthesize the information in these publications, we need artificial intelligence and machine learning. And when you plug in data science and medicine, it's even more daunting. 200,000 publications in 2 decades, and you can see 36,000 in 2020, 44,000 in 2021. So artificial intelligence increases the learning capacity, provides decision support system at scales that are really transforming the way we give healthcare. Artificial intelligence has been applied not only to disease diagnosis and prognosis, but also treatment optimization, outcome prediction, predicting how somebody may be doing, drug development, and public health strategies. But as you will hear from our first speaker, there are ethical challenges in these technological advantages that require collecting and sharing massive amounts of data, and we are just concerned about privacy. These are few select areas where, in medicine, where machine learning, data science driven, has high potential. In the clinical field, we can predict diseases, we can diagnose diseases, we can predict outcomes, and we can actually decide on treatments that are effective. Translationally, at the bench side, this can be very powerful in accelerating drug discovery, vaccine discovery, such as the COVID case, and repurposing old drugs for new indications, and also expediting clinical trials applications. At the public health level, we can look at this discipline in augmenting our ability to predict epidemic outbreaks and to deliver precision health to our population. I thought this editorial was quite interesting. AI is now labeled as a stethoscope. This is our instrument. This is our tool as physicians, the stethoscope for the 21st century. And really, when you talk data science in healthcare, you're really looking at multiple domains. You're looking how data science can help you in communication, can help you deliver personalized medicine that works for that specific patient, that helps you predict drug interaction if a patient is on multiple drugs, and actually forego any catastrophes. It can be used in radiology and give you image recognition, augmenting the power of radiologists in reading images, automated lab work, improved monitoring from home or wherever the patient is, and optimizing integrated care, all of that while securing confidential and shareable medical records. This is a busy slide, but what I want to tell you is we've moved up till early this century from a paternalistic medical practice where we have our personal theoretical knowledge, our personal clinical experience, and we go and look at the patient's condition, deliver patient care, and look at patient's outcome. Evidence-based medicine came on board approximately 2 decades ago, and in addition to what we have learned in med school and what we've experienced in our practice, now we look at medical research, we have practice guidelines, and we have our personal experience, all of which will go into adjusting medical care according to patients' wishes to improve outcome. But I think the new paradigm is with this huge data that's available to us, this big health data on us, millions and millions of data points on a single patient, are to be combined with what we know from medical research, practice guidelines, personalized medicine based on machine learning to improve healthcare delivery while taking into account patients' wishes. So we've come a long way.